but the message of my speech is, what about the schools who do nothing and leave students starving for belonging in this world and the desperation of joy? My name is Gaelle, I'm 13 years of age and I'm part of the Bolder Healthier Champions. Today I will be speaking about mental health, which is one of my greatest passions. What exactly is mental health? When you hear mental health, what enters your mind? Agony, pain, suffering, or do you think of joy, perfection, healthiness? Surprise, mental health can be both. The World Health Organization states that since COVID-19, there has been a 25% increase in the prevalence of anxiety and depression worldwide. Although for some, COVID was a peak time in life where everything was bliss, for some this completely broke them and changed them. During COVID, children/teenagers were forced to be inside, and this pushed back a lot of natural normal development that would have taken place if COVID didn't occur. Many teens were left to rot in their rooms, yet were so quickly expected to ease back into school. A sudden change like this is so drastic that it could generally take a toll on one's mental health, which unfortunately happened to various people across the globe. Even though the COVID-19 pandemic took place a while ago now, I strongly believe that it is one of the factors which contributed to such high rates of mental health issues. And one of the big questions that still linger in my head, possibly yours, is what and where was the school support? Anyone between the ages of 11 to 18 can tell you they spend majority of their time at school. For some it may even feel as though they live at school and visit home. As a result of this, everyone around you, pupils, teachers, pastoral team, become used to you, how you act, and generally grasp your characteristics. Why is this relevant? Because where is the genuine support for those students who go from loud to quiet? The students who randomly keep picking up the tensions? Are you sure they're just trying to be a pain in the backside, or are they at breaking point? Instead of having a go at them, there should be a better way of managing them. So many young people lose themselves mentally and spiritually because of the lack of care that is put in place when teachers can clearly see that they're struggling. Devastatingly, when someone is suffering, underage or not, there are many stigmas that follow. Many of these many get labelled as emo, special, and a lot of disrespectful, foul terms. These stereotypes or stigmas are what push people away from getting help before it is too late. In simpler, harsher words, the ideologies that are placed around mental health, the absence of support, is what leads to suicidal thoughts. However, I want to prevent this. I'm sure everybody in the room wants to prevent suicidal thoughts. And I want to make it transparent what I mean by this speech. It isn't to say schools do nothing, that is a heavy generalisation. But the message of my speech is, what about the schools who do nothing and leave students starving for belonging in this world and the desperation of joy? Thank you all for listening. I'm now going to hand over to Bob, who is a much better professional than me.
More professional than I could ever be, I think. Before I start, I just wanted to comment on something that we talked about at the very beginning, that my background and profession and training is in youth work, and I'm incredibly proud of that. And as somebody that works in mental health and has worked in youth work, we massively underappreciate the impact that youth work can have, not only on kind of health and well-being, but mental health full stop. And I think, unfortunately, some of us that are a bit older in the room have been through lots of different experiences that, unfortunately, the youth services are often used as the political football to make the cuts. And I'm conscious that I'm trying not to eye up our councillor too much. But I think people in this room will know the impact that youth services can have. And I know that my service is impacted much more because of the lack of youth services that we continue to have. Kind of the way it's been contracted and smallened and stuff like that. So I just wanted to say that passionately. I've seen the impact that youth workers can have, and the opportunities that young people get through that. So yeah, that's my, I just wanted to kind of share that because that's really important. And I think you can see the power in the young people here today and the impact that they can have. So yeah, anyway, a bit about me and what I do. I am the Participation and Engagement Lead for Forward Thinking Birmingham. Does anybody not know what Forward Thinking Birmingham is? Hands up if you don't know what it is. Okay, that's more people than I would hoped. So Forward Thinking Birmingham is the youth mental health service for Birmingham. We're unique in the country that we are one of the only mental health services, I think there's one other possibly down in Norfolk, that works with up to 25-year-olds. So many of you would know the term CAMS, Community Mental Health Services, or something along those lines. But in Birmingham, we have Forward Thinking Birmingham. We work with 0 to 25-year-olds. And my role is the participation and engagement lead. So my focus is on making sure that young people, those that use our service, are part of what we do. And that's what I'm happy to kind of be here and talk about. I think there was a picture on there and it reminded me I really need to get my hair cut. So one of the things that I do that is a massive privilege is I work with a group called Think for Brom. And I have popped some business cards on your table. There's some QR codes and some information, and there's a quote on the back from one of our young people. But this is our service user steering group, our group of young leaders. I'm really proud of a lot of the things that group have achieved. We've had 3 Diana Award winners come through our group, and a number of our group have gone on to work within the NHS and others. At least one of our members has gone on to launch their own charity, all through kind of hopefully the impact that they've been able to learn and engage through Think for Brom has been part of that. But we're a group of young people, many with lived experience of mental health, whether that's through experiencing within the service or kind of just a passion and a drive for mental health. We've got people that have had experience right the way up to inpatient care in crisis. And they help shape our service, challenge us, help us to improve, get involved in various different elements. And one of the things I wanted to talk about today is what's on the picture on there is our wellbeing passport. So a lot of our young people talked about the fact that when they're within services or they're talking to different people about their mental health, they often have to retell their story or reset down those relationships or share with people who you can speak to, who I don't want you to speak to, talk about kind of what to say to me and what not to say to me, or just struggle with communicating and starting the appointment. So we thought about what could we do to tackle that, what can we do to challenge that. And again, it was the young people that came up with the idea of a wellbeing passport. And we were able to bid through our Forward Thinking Birmingham as part of Birmingham Women's and Children's Hospital. We were able to bid through the charity to get some funding to create this. The initial print run was only 100, and many of those have already gone, unfortunately, but we've had some really good feedback. But again, fully kind of created, co-produced every single page. So the colours, even the paper, the way the folder is, young people designed and delivered this and worked with our graphic design team to deliver it. And we've had some conversations with the Bolder Healthier champions about possibly adapting this and using this within schools. We had the pleasure of supporting the local authority recently with a mental health scrutiny report, and a number of our young people, we were able to facilitate a number of the councillors meeting with the young people, meeting with some parent and carers as well. And we were able to talk about what are the issues that young people are facing. And one of the things that we came back to, which slightly talks about what we said at the beginning, was around who are the people that I can speak to when I'm struggling? Who are the people so one of the things we talked about was trusted adults. And the group said, if I'm struggling, I'll speak to my peers, or I will look online and things like that. And often many of them said that the response they get in schools is one on behavioural, or it's a safeguarding issue and stuff like that. Well, what they want is just somebody to listen to them and understand. So that's another piece of work that we've been involved in. And hopefully this idea of supporting each other and empowering peers to support each other is another thing that we talked about within Bolder Healthier Champions as well when we met. But yeah, I just wanted to advocate for, if you want to get involved and you want to kind of impact on our service, we're really keen to help, really keen to listen, and really keen to find a way of doing that, but also hopefully continue to work together on finding those ways that will help young people with their mental health and their well-being going forward. So, yeah, is that right? Well,